Well, my difficulty was brought on by a couple of accidents. One where I broke the top of a bone when the elevator at work fell to the first floor. And then there was a day where there was some water on the stairs, and then my foot slipped out from under me, and I further damaged, especially my right knee. And so I was in a brace and physical therapy for probably about 2 years, and really didn't see any improvement based on the physical therapy. Well, I take that back. There was some, but it wasn't substantive. I mean, I still had the problem. The reason I decided to try a Shockwave, and I actually didn't even know about it, the way I found out about it was Dr. Farrar had a seminar that he put on at a local restaurant and sent me an invite about neuropathy. So that was the focus. Until I got in there, we didn't even address the idea of tendons and ligaments and meniscus and all the rest of that stuff. So I went in for the neuropathy piece because I was experiencing some of that. And through my treatments here, he's addressed not only the neuropathy, and I've got much more feeling in my feet, which was a concern because I had a friend who had a toe amputated because of various complications of neuropathy. So I've dodged that bullet. The Shockwave has really not just helped the condition, but has actually in many cases reversed the problems that I was having. And I came in here with the idea that the only thing that was going to fix me was a $90,000 knee replacement. Turns out that for much, much less. There's the idea of keeping all my body parts and not having replacements, which is a plus, because every surgery there is some inherent risk. Here there is absolutely no risk. And I don't know whether you know much about this device as you're listening to me, but essentially it hammers away at the ligaments. And what that does is it causes T cells to come and actually fix the ligaments. I didn't think that was possible, but it's been amazing. And I've had quite a bit of success. You know, and you think, well, when did you start feeling improvement? Well, it was after the first treatment, because suddenly it wasn't difficult to be able to think about going up a set of stairs. So that was gratifying. The way my body feels now and what I anticipate for the future is that my balance will be better. It already is. And so balance indicates that you're not going to fall, which is this device. I experienced pain at the number 1 setting, and now we're up to 6 and 7. And then I know these numbers mean nothing to you right now, but that's because I couldn't stand anything above 1 or 2. And now I'm up 5, 6, 7 on the settings in the machine, which means that my ligaments are healing themselves and more of the scar tissue is going away. Let's say you're facing either a knee replacement surgery or Shockwave. Well, number 1, you can always do the knee replacement surgery in the future, but do you really want to? There's dangers inherent in any surgery, even dental surgery. And I've heard some horror stories about knee replacements that either have to be redone or somebody's gotten a bone marrow infection and they're having to take a regimen of antibiotics to kill that infection. I'm sitting here with all of my body parts, none of them have been removed, and I'm seeing improvement. And it didn't take a $90,000 surgery to get me there. And so if you're interested in having a non-invasive program that is going to help you and avoid all that cost, not just the cost of the surgery, but the cost of the recovery and all of that stuff, I'd recommend giving Shockwave a try. There is no downside to giving it a try.